It is a country that is notorious for its lack of transparency on all matters. Now, from the beginning of the COVID pandemic that originated in Wuhan, China has brazenly concealed from the world and its own people critical information about the origins of the virus, the dangers and massive spread of the disease, both within its borders and outside, and essentially the gravity of the entire situation that unleashed the worst pandemic of this century. A pandemic that wreaked havoc across the world, took over 7 million lives, destroyed millions of other people, wiped out entire families, devastated whole countries, and ravished economies. China has consistently lied to the world and to its own people. Little wonder then that China has now gone ahead and deleted its COVID death data. According to a report published in UK-based Financial Times, Zhejiang, one of the most populous provinces in China, has deleted the mortality data that indicated the high death toll caused by Beijing's abrupt relaxation of its COVID regulations at the end of last year. The newspaper has referred to the statistics that were released by Zhejiang province last Thursday, which showed that the number of cremations in this wealthy coastal region during the first quarter of 2023 jumped a whopping 73% compared to a year earlier. The number had been pegged at 171,000. Much higher than the 99,000 and 91,000 deaths reported during the same period in 2022 and 2021, respectively. When this data created a flutter on the Chinese social media, Zhejiang province decided to delete the numbers altogether 4 days later. Like we said, right since the beginning of COVID-19, experts have repeatedly called out Beijing for its dubious statistics on the pandemic. The first known case was reported in China towards the end of 2019, and when it started to spread, it was declared a public health emergency of international concern in January 2020. Countries around the world were always skeptical about the data coming from China, as concerns were raised over the transparency and accuracy of information about COVID's origin, the number of deaths in that country, and a lot more. For 3 years, China resorted to extremely stringent COVID measures that were in fact draconian in nature in an attempt to curb the spread of the deadly virus. But in December 2022, when the country suddenly revised its pandemic policy, hospitals and crematoriums were inundated with COVID patients. But Chinese officials have refused to reveal accurate statistics that would allow experts to properly estimate the impact of the virus's spread across the population. No less than the World Health Organization has accused China of grossly underrepresenting the severity of its coronavirus outbreak and the real number of deaths, an allegation that China continues to deny. Fact is, China has not released any reliable COVID data till date, and whatever numbers are available in the public domain are highly questionable. As if that's not bad enough, just recently in an interview, a researcher at the Wuhan Institute of Virology made an astounding claim. Chao Shao said coronavirus was engineered by China as a bioweapon and that his colleagues were given 4 strains of the virus to find out which one could spread best. The question is simply this: isn't it time the world held China accountable for the COVID pandemic and demanded some answers? All right, let's go across to our panel of experts. We are joined at this point by Dr. Ranga Reddy, President of the Infection Control Academy of India. We're also hoping to be joined in a moment by Dr. Dheeraj Kaul, a clinical researcher and data analyst in New York, whose work has largely been focused on COVID in the last 3 years. All right, Dr. Ranga Reddy, good evening. Let me start with you. Like I said, for 3 years now, China has been anything but transparent about coronavirus. The world is still wondering how the virus originated and spread all over, killing more than 7 million people. No matter how hard you try, no answers seem to be forthcoming from Beijing. What are your thoughts on the latest revelation that's been made by the Financial Times in this report that says that China has deleted its own COVID death data because the numbers were thought to be alarmingly high, and China, being China, simply does not want to be subjected to any kind of scrutiny, not by the world and not by its own people?
Thank you very much for having me on your show. Yes, this debate probably would continue for decades to come on who is the perpetrator of COVID-19, which had been the health emergency of this particular century. China, all the fingers are shown at Beijing by both the World Health Organization and also the civil society organizations and the governments for their lack of transparency. From the beginning of this pandemic, China always had been in a hide and seek mode where it was not forthcoming very clearly on the origins, the cause of whatever has happened in Wuhan, and at the same time they are also forthcoming with the data. That is what is the accusation which is made by many organizations across the world. And there seemed to be some truth and also some credence to all those accusations made by a whole spectrum of organizations, from the country leaderships to the civil society players. Now, coming to this particular instance, where after the declaration of the pandemic to be over, still fudging the data, I can't fathom what could be reason behind it. Unless the countries are going to come very clearly, very transparently with the data, that is going to be a biggest obstacle for the pandemic preparedness and ensuring that whenever we are going to encounter yet another pandemic, what kind of actions to be taken and what we can do in order to not only respond but also prevent and prepare for the future pandemics. So if the news which is being published by the UK-based Financial Times is right, then certainly the countries and also the United Nations and the World Health Organization had to come very strongly on China in order to ensure that they are going to come out with all the truth, so that that truth can be the basis in order to make the future decisions.
Well, you're right, but I will stick my neck out and say the unfortunate reality seems to be that even the World Health Organization has failed to come down strongly enough on China in the last 3 years, and clearly the international community has failed to hold China accountable. Let me now go across to Dr. Dheeraj Kaul, who joins us from Miami in the US. Dr. Kaul, as I mentioned at the start of the show, the Zhejiang province in China published some data last Thursday which showed that the deaths that had been caused in China on account of COVID in the first quarter of 2023 saw a 73% jump compared to 2022 and 2021. We are looking at a figure of somewhere around 171,000 deaths. As soon as these figures created a flutter on the Chinese social media, the government of Zhejiang province decides to delete this data. We all know that in December last year, hospitals and crematoriums across China were overflowing after the country abruptly relaxed its stringent COVID rules. And now, the World Health Organization is accusing China of grossly underrepresenting the severity of its coronavirus outbreak and the real number of deaths. My question to you is, would you agree that China clearly does not feel that it is accountable to the world for a pandemic that it, in a sense, unleashed on the world? Secondly, when
Thank you
we
so
do
much.
not have enough information available about China's COVID outbreak and the mortality rate, doesn't it impact the overall study of the pandemic and the virus itself?
Thank you so much for having me on the show. I think this is an amazing and very well put out question, what you're raising. Actually, we have been raising this concern. So I was attached with COVID data research from January 2020 when people started hearing about it till all the way till this year, April, and been following the data from different countries coming. And you're absolutely true. There are 4 points to your question. Number one, the basis of fighting with COVID is to sharing data across boundaries, across governments, could be socialist, democratically elected, dictatorial, or communist. It doesn't matter. It's human race. So we had to share the data to help science evolve. But the data coming out of China was always spectacle. There were questions that they are lowering the mortality, lowering the hospitalization rate. The numbers you're mentioning, I have seen that report, 174,000. Matter of fact, we anticipate the COVID numbers, which were dropped down by China, with anything between 80 to 120% lower than what was shown. I'm talking about mortality and ICU admission rates. Data coming out of China, you have to take it with a pinch of salt because the government really monitors it very closely. And China, if you know, the efficacy of Chinese vaccine was also under question. So the question would arise after getting fully vaccinated. China, matter of fact, claims to have fully vaccinated at the fastest rate. But then the efficacy of that vaccine was under question and jeopardy, that how come people who are fully vaccinated are dying from COVID? How come people who are fully vaccinated are getting ICUs, intubated? If you look at the number of lung transplants done, so I work at a transplant center, the lung transplant has been picked up after COVID and damages. In China, the number of lung transplant has also drastically gone up to such a limit that they don't have enough manpower, enough trained physicians, ICU critical care people to manage lung transplant. Like I'm getting actually I'm in a program where we manage lung transplant patient every day. Matter of fact, saw 5 of them today. So the point I'm trying to raise is unless we share information, we cannot find COVID or the new variant of COVID, which may evolve, or any other bug. And this is causing real concerns at the galleries of WHO, international organizations who follow data, who trigger pandemics, who trigger epidemics. Because you have to understand, before pandemic, you have a stage of epidemic. And if there is a delay in reporting, it can mess up a lot of things for a lot of people. And that's exactly what happened with COVID. We were not alerted in September. Now, new studies are showing, new data points are showing that COVID prevalence in China had picked up in September, October, November 2019, not January or December 2019, now what we are talking about. So the timing is the key. You have to be a step ahead of the virus, which is the hardest thing to do. But when you share the data, when you share the number, we know the trajectory in which the virus is going. When you tell us what kind of vaccine you are using, when you tell us what antibiotics you are using, antivirals you are using, what steroids you are using. We manage COVID I have seen hundreds and hundreds of COVID patients. I have seen many patients who have multi-organ transplant, immunosuppressed, and we are managing these challenged patients. But our data is public. In US, any hospital, you can go, you can figure out the COVID numbers, even today, as of hour to hour. So transparency of data is very big, and this will affect the fight against COVID. We all are fighting, and we are still fighting. COVID is not over. There's mortality from COVID. There are people who are hospitalized. There are people who are losing their lungs to COVID and requiring transplant. So it's an ongoing battle, and you are absolutely right. It's a very concerning point that why would you fudge numbers and hide the data from international community?